there was an article in the Gazette this morning that specified over the Easter long weekend, there were 5,000 appointments that were unfilled. Can you explain, you did in French, about why this is the case, but can you explain why you didn't then open appointments for people with chronic illness sooner, last week, for example, in Montreal?
Well, I just want to put in perspective that the famous 5,000 vaccine or appointment is on about a total of 300,000 in that week. So just to put that in perspective, that's less than 2%, right? So I think the second thing that I want to mention is that it is normal that in a situation where we receive the vaccine in an unplanned way, we're not deciding when we receive the vaccine. So what we've asked our PDG, and this is the coordination that Daniel does, is we ask them to try to estimate ahead of time the number of appointments they could open, even though they are not sure when they will receive the vaccine. Because we'll see this week, Moderna is a few days late, and we still have taken appointment. So I think it's normal, and I know it sounds like a bit boring to discuss logistics here, but it's just normal problem of logistics. We plan a little bit higher the number of appointments to make sure that people have an idea that they should come in 2 or 3 days from now. But unfortunately, sometimes those people that we've planned for, they don't come for certain reasons. This is what happened during the Eastern weekend. People that had sometimes make an appointment, they decided not to come. It's sad, but that's their decision. But we have not lost those vaccines. We took those 5,000 vaccines and we redistribute them in the region that need them very badly right now, in Quebec, Chaudière-Appalaches, and Outaouais. So are we able to plan perfectly at 99.9% in an environment where we don't know when we will have the final confirmation of delivery? No, we're not able to do that. We're doing our best. I'm saying 5,000 vaccine over 300,000. I think that's a pretty good record.
But in Montreal, 77% of people 60 and over have been vaccinated. So when you see that there are appointments available, why not say, okay, people with chronic illness, let's get that going sooner?
But as I said, and I think I appreciate your answer to the question again, we have some rule. This is not a political decision. We have some rules to follow with public health. They're saying you need to have finished a category, and that limit is 75%. We need to have the target of each category done before we move to another one. I could not go on Saturday morning and by my own with Danielle saying, well, we have those 5,000 appointments. Can we start right away? I mean, this is not fair. We need to give the time for those people in those categories, illness, those professors, those policemen need to know a little bit in advance. So this is what we done on Monday. Public health had been very quick. They reacted, what day are we today? Wednesday? They reacted yesterday, and we have their opinion, and we're vaccinating tomorrow. So I think we're reacting.